This recorded session is dedicated to the completion lecture for our final module for the subject. So, as a recap, last lecture sessions, our on site lecture sessions, we discussed the morphology, the general characteristics of parasitic trematodes. We also covered the major groupings according to the habitat of the representative species, and we discuss about their notes on their diagnostics, how we diagnose infection for a particular trematode species. We also cover their generalized life cycle and important notes on the morphology of the parasitic eggs as well as the adult worm. So now, let's complete our discussion by looking into some more discussion topics about the blood flukes, and finally, we'll cover the virulence determinants um, of these parasites in a more generic manner. No, so we have a summary table at the end of our discussion for the generalized virulence determinants of these parasites. So the for the three major types or three major schistosomiasis causing parasites. Let's have a few more discussion topics about them. So, Schistosoma mansoni is common blood fluke in Africa, South America, and parts of the Caribbean, where the intermediate host species of the snail, Bionfilaria, are mostly distributed. No? So the Cercaria from Bionfilaria can penetrate the skin of the definitive host. As a reminder, important that one of the major differences of the blood flukes compared to the other types of trematodes is the fact that they do not have metacercarial stage. No? So the cercaria is a primary transition stage to the adult worm. No? Coming from the sporulation or the asexual stages of these blood flukes. So for Schistosoma mansoni, the eggs are deposited by the female in its preferred tissue or habitat, which is the mesenteric veins. They're swept into the liver, and they can elicit an inflammatory response. It can cause fibrosis or tissue development, extra tissue development in the site where they lodge. No? And this process can cause hypertension, portal hypertension, and hemorrhage of related blood vessels. Also, the lesions may occur associated with parasitic invasion in the definitive host. So let's take a look at the adult worm. So here we're seeing Schistosoma mansoni, male and female adult worm can appreciate the specific structures common among trematodes, the suckers, oral and ventral, as well as structures involved in the reproduction of the ova, so the uterus of the female worm, you can see here, and the ovary pointed in this artist rendition of the adult worm. So when we stain them, they look like this. So here, let's see if I have a pen or a highlighter. Okay, so you can see the bigger male, where the female individual is actually found on its gynecophoric or gynecophoral canal. No? Okay, so in tissue prep, or sorry, in slide prepared slides, you can see schistosoma looking like this. It looks like a single individual worm, but could possibly, I think this is a male one. There's no associated female adult worm. So in this representation, you can see the adult female found on the gynecophoral canal of the male individual worm. Okay, so a few more comparisons between the three types of, or the three major species causing human schistosomiasis. So, in terms of tuberculation, the tegument of the worm, there are tubercles or protrusions, could be smooth or not. Now, for Japonicum, the tuberculation is said to be smooth. For Mansoni, the tuberculation is said to be coarse, and for Hematobium, it is more fine compared to Japonicum or Mansoni. So it has a tegument that is more smooth compared to the other two species. Number of testes also vary. Japonicum and Mansoni are comparatively the same. For Hematobium, lesser in number. In terms of the ovaries, positioning and arrangement are also different. The ovary for Japonicum lies behind the midplane, while for Mansoni, the ovary is situated anterior half of the body, is more frontal, while for Hematobium, the ovary is posteriorly located. No? The uterus also can contain a different number of eggs. For Japonicum, they can have 50 eggs at one time. For Mansoni, about 20 to 40, and Hematobium is the most prolific, may contain at least a range of 20 to 100 eggs. Okay. So how do we diagnose the parasites? Similar, or the parasitic infection in a definitive human host. So similar with the other types of, or other species of Trematoda, demonstration of egg in feces or other samples such as rectal or liver biopsies and urine are important. So it's definitive indication of parasitic infection. No? And there are other techniques. We can use the Foss and Melanie's egg hatching technique as a diagnostic tool. So what we do with this technique is we check the presence of schistosome eggs in stool samples. No? This is especially for the case of Japonicum. No? So we essentially allow an in vitro we carry out an in vitro setup where we allow the miracidium to hatch from the eggs so that we can further identify the species of the blood fluke parasitizing the individual or parasitizing the patient. Then we also have this other method, the circumobile precipitation technique by Oliver Gonzalez. So Oliver Gonzalez, it is a I don't know. This actually refers to one individual only. No? So the COPT technique is a serological test. So what we do here, we incubate the putative patient serum acquired from the blood or from other samples um, with schistosomal eggs. No? And the formation of visible precipitates will indicate that there is parasitic infection. No? Okay, so here let's have the generalized life cycle of schistosoma species. So adult worms in copula, when the male and the female are in contact in their habitat of choice, the egg shed through feces or urine. Then hatching from it is the miracidium, the active ciliated organism, and it's now this miracidium can penetrate the head foot of the Biomphallaria species. Okay, the spore inside the intermediate host, sporogony or sexual reproduction occurs. Mother sporocysts can release daughter sporocysts. These sporocysts can carry out secondary no they can carry out succeeding stage of the sexual reproduction, no? Leading to the transitional state of Cercaria. And Cercaria may have an additional stage, no, where they transition to becoming a schistosomolium. So this stage of the parasite is an in between phase. No? It's a transition phase between the free living, non feeding Cercaria and the adult worm in the mammalian definitive host. No? So, but in most cases, of course, it's the Cercaria that will target or be able to parasitize the definitive host. No? Okay, so the infection has three key stages: a migratory phase, an acute phase, and a chronic phase. So let's take a look at these stages. So during the migratory phase of the parasite, the Cercaria moves through the body until they lodge into the target tissue. They begin with penetration through egg production, and often this first stage is symptomless. What you can appreciate are potential presence of what we can visually appreciate could be potential presence of rash and itchy skin, and in some cases can cause upper respiratory tract complications such as coughing. And during stage two, the acute phase, this is when post 4 weeks, the post in exposure. So, okay, the adult worms can carry out sexual reproduction. They begin with egg production. Symptoms include the following, such as fever, headache, diarrhea, fatigue, and non-specific abdominal pain. Okay. So here on this tissue section, you can see eggs that are produced, no, associated with the parenchymal part or parenchymal section of the target tissue where the adult worms are laying their eggs. The last stage, which is the chronic, is prolonged infection, which can take up to years. No? Symptoms already include wide system-wide or organ-wide damage, cirrhosis of the liver, kidney damage, bleeding of the upper bowel, urinary bladder damage, and enlargement of the liver and the spleen. So you can see here enlargement of the associated internal organs, and you can appreciate the inflammation of associated tissues. The incidence for schistosoma, very um, the endemic areas you can see are highlighted in blue. So our country, the Philippines, as well as some parts of Southeast Asia, they can hepatic and intestinal schistosomiasis can be well seen. No, in areas where both types are very endemic, you can see African countries. No, urinary. Urinary schistosomiasis in yellow, light yellow colored sections or countries as represented in this map. Okay, so some risk factors associated with schistosomiasis. The number of infected patients can reach up to 200 million infections globally. No? And 20 million are seen to have chronic schistosomiasis primarily because the infection is tied to consumption of the intermediate host, and about 600 million people are at risk of having schistosomiasis. And this is tied to factors such as lack of public health facilities, extreme poverty driving this population at risk to consuming the intermediate host as protein source, and sanitary conditions, and public education or public awareness. People are not really aware about the probability of them getting schistosomiasis by eating secondary intermediate hosts. No? So how do we prevent schistosomiasis? So essentially, no, we can do a number of things. We can avoid swimming in fresh water in countries where the prevalence of the parasite is actually very high. So avoid swimming in fresh water since the Cercaria is active, free swimming, and its nature is to look for the definitive host. So it will swim in fresh water and it can penetrate the definitive host since it has penetration glands. No? You can make sure that you also drink clean water to prevent getting the parasite. When we think or in instances where there is potential accidental exposure, we can properly, totally clean our external skin. So to remove any potential cercaria trying to penetrate our intact skin. You can also use water-resistant creams in order to serve as in order to provide a barrier such that the parasite will not will have lesser chance of being able to penetrate our skin. And of course, nail control. Very important that we control the population distribution of the intermediate host, since without the intermediate host, the life cycle of schistosomes will be impeded. No? But again, that's a major issue because these snails are also considered as dietary I don't know, dietary elements of people in countries where schistosomiasis is highly prevalent. Okay, how do we diagnose and treat the infection? So we can use blood tests. We can examine the stool and urine samples of potential patients to detect the presence of parasitic eggs. A number of drugs can be used to treat the infection, such as praziquantel, effective in the treatment of all forms of schistosomiasis and has no side effects. No? Oxymniquin, which is used exclusively to treat intestinal schistosomiasis in Africa and South America, and metryfonil, which is effective for the treatment of urinary schistosomiasis. Right now, we're already developing, no, there are a lot of people working on vaccination, a candidate vaccine, but we don't have success yet in developing a clinically safe and effective vaccine against schistosomiasis. Because similar with dengue, similar with malaria, no, schistosomiasis is an important parasitic infection. So we really have to do all the effort, no, concentrate our scientific efforts and endeavors, uh, or some of us who work on ano, no, these worms, we can concentrate our effort on vaccine development. Okay. Now, generalized virulence determinants of parasitic trematodes are summarized in this table. So I want you to be able to take note and make sure that you review this section, since a great chunk will be coming from or a number of the final exam questions will be coming from this section alone. No, so in terms of adhesion, some examples of virulence determinants for trematodes include lectins that are found on the tegument of the adult worm, for example, fasciola. So these lectins allow for binding of the adult worm to galactose residues of cells where the worm, galactose residues of cells comprising the tissue of choice for the parasite. So it allows them intimate connection or adhesion to the host. Can also ensure that the adult worm is properly anchored. No, it increases the anchoring of the adult worm to the tissue. Also, we have another example of adhesion factor, which is surface enolase for the case or um, for the I don't know for the um, case of schistosoma. This is an enzyme which allows for binding of the adult or allows for binding of factors from the schistosoma to host plasminogen, and it will facilitate attachment. So enolase that can be expressed as an extracellular product secreted, lodged into the tegumental surface of the parasite, can serve as a matrix between the parasite and the host. No? Then for invasion, there are a number of enzymes that can be considered as virulence determinants. Cysteine proteases, so we have catepsin L-peptidases for the case of fasciola, which can degrade collagen and the basement membrane of connective tissue, allowing the parasite to explore extra tissue sources or extra tissue parts of the definitive host where they can stay. No, metalloproteases, which are a specific example of enzymes allowing for I don't know, allowing for cleaving of extracellular matrix proteins. For the case of schistosoma mansoni, no, a number of studies report on a metalloprotease produced or expressed by S. mansoni, similar with that of the protozoan Leishmania. Aside from metalloproteases being able to cleave extracellular matrix proteins, they're also been found to function in immunosuppression. So the enzyme is able to disrupt complement activity. No, they can primarily because they have cleaving. I don't know. They have cleaving or degradation activity, so they can degrade complement elements. No. Then, of course, our classical hyaluronidases, collagenases. The case of clonorchis, these enzymes can disrupt intracellular matrix, allowing for the parasite to carry out deeper parenchymal invasion, and eventually the tissue is damaged, penetrated at a very high, I don't know, very high rate. So parenchymal destruction is inevitable if this is not controlled. For evasion, a number of virulence determinants include cystatins, also for the case of fasciola. So these are protease inhibitors. They can inhibit host lysosomal cathepsins, essentially allowing protection of the parasite. So if instead of the parasite being attacked by um, ROS mediated strategies of the host tissue or the host cell. So these protease inhibitors, cystatins, also a common term, or some authors termed it as stethins. So they inhibit the lysosomal dependent immune strategies of the host against the parasite. Also, antigenic variation is very common among Trematoda. Okay, so they secrete or they express proteins on their surface, the adult worm. Also, in some cases, might be the diagnostic eggs. For the case of S. mansoni, it's documented, very well documented strategy to evade the immune system of the host. The rationale is the constant shift of surface antigens will impede antibody development. Because imagine the parasite shifts antigenic profile, therefore, previous cycles that already elicited antibody dependent response, and antibody dependent immunity, that might not work anymore for another cycle where the surface antigens of the parasite has changed. Then we also have another example for schistosoma, complement binding paramyosin. So paramyosin can be found in the tissue, no, of can be found in the muscle tissue of um, the parasite. So these complement binding paramyosin can bind to complement elements like C1 and C9, and the entire complement activation cascade shown here can be deactivated. So the classical pathway where there's presentation, there's development of antigen antibody complex, where complement 1 C1 molecule is involved, so that classical pathway can be impeded for the case of I don't know, for the case of these complement binding paramyosin, no. Another for C9, so yung ating eventual lysis, cell lysis of development of pores, the complement strategy where pore formation, no, in the cells of the parasite that can also be evaded or prevented by these paramyosins, no, these complement binding elements. Okay. Then we have for other additional for toxicity factors, we have omega 1 specific to Mansoni. It's an egg derived RNase. It can induce damage to hepatocytes, and it can also drive polarization of T cells, therefore preventing succeeding T cell dependent immunity. No? Succeeding T cell dependent pathways. Okay. And we have prostaglandins and biogenic amines, which are secreted factors by most of these trematoda. No? So these molecules can trigger vasodilation, edema, and localized inflammation, especially in the preferred tissue, where these compounds from the adult worms are secreted. Okay. So that ends our lecture for our final lecture for the course. So please make sure to watch this recorded lecture as completion for our final module.